Welcome to another episode of Max Living Radio. I am Dr. Jake Tucker here at Good Life Family Chiropractic Studios on the south side of Lincoln. Proud to be voted Best Chiropractor of Lincoln 2017. Top 4 finalist here while the voting is still open at bestoflincoln.net. You can go there while you're listening to the show and vote for your favorite chiropractor and all the best businesses of Lincoln as well. Today we're talking about heart disease. We want to keep you from dealing with what most Americans deal with. 50% of Americans approximately will deal with heart disease at some point in their life. Every single American I know of knows someone that is dealing with this on a daily basis. So this is something that you need to know about. We need to get ahead of this. We need to talk about cause, because cause allows us to get to prevention. It allows us to get to starting to reverse some of these chronic diseases that hit most Americans. We're talking specifically about heart disease today, but you think about the things that Americans deal with, and these are chronic lifestyle diseases, ones that we know you can help to prevent by making proper lifestyle choices. And so we want that for you. And so plug in today. We're going to start off talking about something that most of us recognize. When you have heart disease, you're going to have high blood pressure. It's not a 1-to-1 ratio at all, but very often when you go to your medical doctor and you get your physical, the very first thing that they'll check, and they'll even have the nurse do this for them so that they can know walking in what they're dealing with, is to check your blood pressure. And now normal blood pressure levels have been changed and they've come down over the years. We found that we want our blood pressure range to be about 120/80. And that recommendation, just based off of the medication that they're studying, has been coming down. It used to be around below 140, in a range between 130 to 139 over 80 to 89 used to be considered normal. But it's something that we want ideally to be around that 120/80, maybe slightly lower than that. And that would put you in the normal blood pressure levels. Most Americans end up higher than that. And there's a lot of factors for that. Number one is we are more stressed now in these United States of America than at any other time in the history of the world. And that has to do with the technology, the life that we live, the way that we go out into our communities and we make a living, we multitask, we drive, and we listen to a phone call, and the kids are screaming in the back, and we got to get them to daycare, and we've got to get to work on time, and there's a meeting and we have to answer the cell phone. All these different things, they start overwhelming us. And I can tell just in myself this physiological change that happens when I talk about all the different things that I have to deal with. My blood pressure comes up. Your blood pressure maybe even came up as I talked about all those things that you have to do today. And so that's one of the first things that we have to do, is we have to target the factors that we can control. We can control our stress. We may not be able to control the stressors, but we can absolutely control our response to the stress. We can take responsibility for our schedule and we can stick to it. Most of you, if you've been on Facebook, if you're watching this on Facebook, you've seen posted the video of the professor that's lecturing his class about how to organize schedule. And he starts with a jar, an empty jar, and he puts golf balls in it. And he asks his students, is the jar full? And his students answer, yes, of course, the jar's full. You can't get any more golf balls in it. Then he starts to put small pebbles in there. Then the pebbles start to fill up the jar, and it gets to the top, and he asks, is the jar full now? And they say, absolutely yes, there's nothing else that you can fit in there. Then he puts in sand. He starts pouring sand in, it falls in between the pebbles, and it fills up the jar. And he says, now is the jar full? They say, absolutely. Absolutely, there's nothing else that you can get in there. And then he opens up a bottle of Corona, pours it in, and obviously it fills in between the sand and it gets up to the top. And he says, the golf balls, those represent the most important things, the things that you have to do on a daily basis, the things that you value the most, whether that's work or time with your family or time with some of your best friends. Those are the things that you have to make time for first. Because if you go in and you fill up your jar, your 168 hours that each of us has in a week with something else, then that will keep you from being able to put those golf balls in. If he had started with the Corona, there's no way a golf ball would have filled in. If he had started with the sand, there's no way he could have fit in any pebbles or any golf balls. And if he had started with the pebbles, there's no way he could have fit in the golf balls. So you need to prioritize the golf balls, those things that are most important to you. Then as you go down the list, prioritize those other things as they come up, but always make sure that there's time for relaxation, time for yourself, time to rest and come back. So that's the number one lifestyle factor that you can control. Number two is smoking. Honestly, do I need to talk about smoking? You shouldn't do it. If you're doing it, start working yourself off of it, because smoking, just taking anything toxic into your lungs, it stresses out your heart, because that's where the blood that your heart is pumping through your body gets oxygen. And when you block the ability of your lungs to absorb oxygen with any toxin, whether it is smoked nicotine or smoked marijuana, any of those things will keep you from being able to get that into your body and stress out your heart and create more of that toxic environment. And so, you want to stop smoking. Absolutely. If you're addicted to it, if this is a lifestyle habit, if you're one of those people that takes baby steps, start by just having one less a week. If you can do one less per week, you will make a huge difference in your health. This week, stop one. Next week, stop doing one more. The week after that, stop doing one more. And before you know it, you're going to be at pack. You're going to have more money in your pocket than you ever realized you had the ability to have. And you'll be able to start becoming healthier. The third thing is overweight and obesity. And so we all know what it takes to lose weight. And sometimes it's a little bit more complicated than just eating right and exercise. If you need coaching through that, I am here, 402-413-8825, to help coach you through that. But what we focus on is the cause of that weight. Some of you need to get your eating habits back under control. You need to stop doing all the cheap processed foods, and you need to start doing whole, real foods, so that when you eat a meal, you actually feel filled up. If you're eating a meal and you don't feel filled up, you're doing it wrong. You should be feeling full by the end of the day, by the end of the meal, and at the end of every single meal that you eat during a day. Then exercise. If you're not exercising, just start. If you're exercising and it's not making a difference, you need to change the style of the exercise you're doing. Doing something is better than doing nothing. Doing something well, doing something better is always worth investing in. And so start exercising. I highly recommend, if you have never tried it, high intensity interval training. You can do it no matter what your fitness level is. And so get in, start applying it, start making that difference in your life. But the last lifestyle factor that you can control is your nervous system and how well that is healing and functioning. It's the number one most important system in your body. And it controls every other system. It controls how well your heart is functioning, is directly controlled by your nervous system. I mean, you think about it. Your brain, for your heart to beat, for your lungs to breathe, for a cut on your leg to heal, your brain has to send a signal from your skull down the spinal column and out the spinal cord, through the nerve roots, through the nerves, to every organ, cell, and tissue in your body. It has an amazing intelligence inside that runs it without you even thinking about it. Without you thinking about it, your heart beats, your lungs breathe, a cut on your leg heals. There's no medicine that you can take that'll do those things for you. There are machines that we've made that can duplicate what the heart does, what the lungs do. It can duplicate what the bladder does, but it cannot go in there, and it cannot replicate what your nervous system does. Even just sending an electrical impulse through the spinal cord, through the nerves, sometimes does the wrong thing, because it's an intelligence, not just an electrical signal. It's an intelligence inside you that does that. And that should not be interfered with, but we interfere with it so much. And most of the time, this is coming from a physical level, a biomechanical level. And what it is our technology, the way that we live our life, has started to compromise the integrity of the system that's designed to surround and protect the nervous system. And that's your skeletal system, specifically the spinal column and each individual vertebra. They're designed to perfectly surround and protect your brainstem, your spinal cord, and each of the nerve roots as they exit off, and they go to every organ, cell, and tissue. That's the way that God designed your body. But when it gets interfered with, when there's pressure on the nerve roots, when there's pressure on the spinal cord, when there's pressure on the brainstem, or even when there's just not proper motion in the spinal column, in between those vertebrae, it decreases your brain's ability to communicate with your organs and your organs' ability to communicate with your brains, and it decreases the organ function. And so for most of us, where we carry our stress, where we do the most damage with our cell phones, with our laptop computers, is right here, right across the shoulders. And how we do it is we look down, we lean in, and we don't maintain that head above shoulders posture. We let our ears come forward, we let our head come forward, and we've got a bowling ball up here. This is between 8 and 15 pounds, just depending on how smart you are, right? Just depending on what God gave you. This weighs between 8 and 15 pounds, and the spine is designed to carry that around. But every inch that we take our ear forward from our shoulders adds 10 pounds of pressure to the shoulder area, to the neck. It's just like taking that bowling ball in the bowling alley, picking it up and walking it around with your arm way out in front of you. When you do that, it adds 10 pounds per inch that your arm is forward. And so you're doing that to your spine. And so what's the adaptation to that? The adaptation is arthritis. The adaptation is fusing the joints together, because your body is so smart, it recognizes that the spinal cord that it is designed to protect, the vertebral column that is being used to protect the spinal cord, is being compromised by that excess weight. And so you need to get your head back. A lot of you can't. You've been doing this for years. You're stuck in that posture. And so you're stuck with excess pressure on this area right across the shoulders. Well, what does that area control? Where do those nerve roots come out? Where does that go? That goes directly to your heart. The nerves that exit out at the lower portion of your neck, the upper portion of your back, those go directly to your heart. And if you're setting an extra 10 to 20, some of you up to 40 and 50 extra pounds of pressure on those nerve roots, it makes sense that you would be dealing with high blood pressure. It makes sense that you'd be dealing with low blood pressure. Those nerve roots are being interfered with. Your brain cannot communicate with your heart cannot communicate with your brain. The signal's being disrupted. And as that happens, and all it takes is the weight of a dime. The weight of a dime is enough to disrupt that signal by 60%. As that happens, your body starts to decrease in function. Your heart starts to decrease in function. And so if you're dealing with blood pressure and you've never had your nervous system checked for pressure, especially out of that lower portion of your neck, upper portion of your back, then you need to call our office right now, 402-413-8825, and we will make sure that we can get you scheduled with a special 50% discount for the first 5 callers. Just the first 5 will get a 50% discount off of any necessary exam and x-ray to determine exactly what the cause of your high blood pressure is and why your body is not responding and healing it the way that God designed it to. That's what I want for each of you. I want you to be able to know the cause, but I also want you to be able to correct the cause. And so give us a call, 402-413-8825. We'll get that appointment time set up. You know, we'll set that up for you. We'll set that up for a loved one if you know that it's someone that needs the help right now. And we'll get that set up for this week as soon as possible. We do not want to wait on something as critical as the health of your nervous system, especially when it's affecting your cardiovascular system and your heart. God bless you. We'll see you right after the break.